For more anatomy-related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
So, today we will discuss about the external features of the heart. In the previous class, we have already discussed the pericardium, that is the outer covering that separates the heart from the other thoracic structures. So, today we will discuss about the borders, the surfaces and also the grooves of the heart. That is the external features of the heart. So in this figure you can see the anterior aspect of the heart, and in this figure you can see the posterior aspect of the heart. This is the anterior aspect and not the anterior surface. So you can see the four borders of the heart. That is the upper border. It is also called as the superior border, inferior border, the right border and also the left border. So the upper border, it is mostly formed by the left atrium and partly by the right atrium. So the upper border, it is mostly formed by the left atrium and partly by the right atrium. Next is the right border. So right border, it is the border that extends between the superior vena cava to the inferior vena cava, and it is formed by the right atrium. And next is the inferior border. So the inferior border, it extends from the inferior vena cava to the apex of the heart. So the most part of the inferior border is formed by the right ventricle and only partly by the left ventricle at the apex of the heart. And this is the left border of the heart, and the left border, it extends from the left auricle to the apex of the heart, and it is formed by the left ventricle and partly by the left auricle. So these are the four borders of the heart. That is the upper border, inferior border, the right border and also the left border. So now we will discuss about the surfaces of the heart. So heart has got an apex, a base and three surfaces, that is the anterior surface, inferior surface and also the left surface. So first we will discuss about the anterior surface. So the anterior surface, it is formed by the right atrium, the right ventricle and partly by the left auricle and also left ventricle. So the anterior surface, it is also called as the sternocostal surface, and most of it is covered by the lungs and only a part is visible. So next we will discuss about the inferior surface. It is also called as the diaphragmatic surface, which rests on the central tendon of the diaphragm. So here you can see the diaphragmatic surface, and the left 2/3 of the inferior surface is formed by the left ventricle and the right 1/3 of the inferior surface is formed by the right ventricle, and here you can see the posterior interventricular sulcus or groove. So the inferior border, it is also called as the diaphragmatic surface. The inferior surface is also called as the diaphragmatic surface, and the left 2/3 is formed by the left ventricle and the right 1/3 is formed by the right ventricle, and in between you can see the interventricular sulcus. And inferior surface, it is directed downwards and backwards. So next is the left surface. It is mostly formed by the left ventricle and on the upper part by the left auricle, and in between the left auricle and the left ventricle you can see the coronary sulcus. Next is the base of the posterior surface, and it is directed backwards. It is formed mostly by the left atrium and partly by the right atrium. And here you can see the pulmonary veins and also the superior and inferior vena cava. And it is related to 5th to 8th thoracic vertebra in lying position. Next is the apex. It is formed by the left ventricle. It is directed downwards, forwards and to the left, and it is located in the 5th intercostal space, that is 9 cm away from the mid-sternal line and just medial to the mid-clavicular line. So now we will discuss about the grooves or sulcus of the heart. So they are of three types. That is the interventricular sulcus, which separates the two ventricles. The atrioventricular sulcus, which separates atria with ventricle, and also interatrial sulcus, which separates the right and left atrias. So the atrioventricular sulcus, it has got an anterior part and also a posterior part. So the anterior part, it has got an left half and also a right half. So this is the right half and this is the left half of the atrioventricular sulcus. So the right half of the atrioventricular sulcus, it lodges the coronary artery, that is the right coronary artery. And the left atrioventricular sulcus, it is smaller and it lodges the circumflex branch of the left coronary artery. The coronary sulcus is anteriorly hidden by the pulmonary trunk and also aorta. And the interatrial sulcus or interatrial groove, it is also hidden anteriorly by the pulmonary trunk and also the aorta. And posteriorly, it is vaguely seen. So now we will discuss about the interventricular sulcus, which separates the right and the left ventricle. It has got an anterior part and also a posterior part. Anterior part, it is towards the left border, and at the apex it separates the left border from the inferior border. And the posterior ventricular sulcus, it is seen in the inferior border. And the two sulcus, that is the anterior and the posterior interventricular sulcus, it meets at the apex. So this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.